Back, guys. uh, let's start with today's discussion of the question. A 23-year-old man comes to the physician with dysuria and increased urinary frequency. Okay, there is a dysuria, increased urinary frequency. Is a 23-year young man, and is an active duty member of a U.S. military and recently returned from his sub-Saharan Africa, and where he had been stationed for the last year. The patient's symptoms have persisted for several months, had failed to resolve following antibiotic treatment. His blood eosinophils count is elevated. All this is bullshit. Chumma they are giving. Now urine microscopy shows cystosome X. Okay, this is important. And he started on praziquantel. Yeah, they are given the treatment also, and experiencing improvement in symptoms. What's the problem now? The elevated of eosinophils in the patient contribute to the host defense against schistosomiasis. Yes, through which of the following mechanism? Why is it eosinophils is increased? Because of Schistosoma X. That's what they're asking. Mechanism of action of this Schistosoma X. What is most of you answered immediate hypersensitivity, but the answer is antibody dependent cell mediated immunity. This is the answer. I'll tell you why. Okay. First thing is eosinophils. How does this eosinophil perform the functions? Is like, one is parasitic defense, that is by production of cytokines, and then producing major basic proteins and all, and then that is antibody dependent cell mediated cytotoxicity. Okay, another thing is type 1 hypersensitivity reaction. This is actually a type 2 hypersensitivity reaction. Okay, yes. And see, here it is diagram of parasitic killing by eosinophils. How does it killing? This is a surface antigen of this parasite, and IgG is coming, and then antibody dependent cell mediated immunity, right? Antibody dependent cell mediated immunity. Eosinophils are recruited, then they are Fc receptor present on the eosinophils will bind to this antibody, which is attached to the antigen of the helminth. Okay, this is the mechanism of eosinophils killing the parasite. But the other mechanism is also there, like by releasing hypersensitivity reaction, but it is a very early phase. Like immediately it will happen. Allergic, like for an example, allergic reactions due to this is then type 1 hypersensitivity. If then you can tell immediate hypersensitivity. This is not an allergic reaction or any it is not allergic reaction, that is why the eosinophils are being produced. It is because of the parasite itself. Okay, then let's see how this types of hypersensitivity have to know. This is very important. We just remember like A, B, C, D for type 1, type 2, type 3, type 4. Easy, no? Remember this. Okay, A, B, C, D, type 1, type 2, type 3, type 4. Now, what is this? What does it mean? Type 1 hypersensitivity में anaphylaxis, A for anaphylaxis. Anaphylactic reactions will be there. Eosinophils will be recruited. Okay, that is type 1 hypersensitivity. Type 2 hypersensitivity में there are 3 DID. Remember DID. Okay. What is DID? One is destruction, I is inflammation, D is dysfunction. Okay, what do you mean by DID? Type 2 hypersensitivity mein there will be a destruction. Type 2 means B for there are 2 antigen antibody 2. So B, antigen antibody. This is antigen antibody reaction. How does it happen? In 3 ways. Okay, one is destruction, like hemolytic reactions, acute febrile hemolytic reactions, or destruction, inflammation, dysfunction. In that, first we'll see what is cellular destruction. Okay, in this cell is here, if it's a cell, this is the receptor, like for say example FC receptor for IgG. Okay, now another this abnormal cell or any cancer cells, anything, any abnormal cell will come and it shows this surface antigen. Okay, then this will, the antibody will come and bind to this, then this will bind to this, then this will release. This is like for example this, say this NK cells. Okay, this will release cytokines and that will kill the cell. That's the normal type 2 hypersensitivity reaction. That's what you learned, right? In cellular destruction, there is cell is opsonization. That means macrophages are acting. If the macrophages are acting, cell is opsonization and phagocytosis will happen, and activation of the complement system. Otherwise, natural NK cells dependent cellular cytotoxicity, that also can happen. This is cellular destruction. Whenever there is phagocytosis, there will be destruction of the cell. That is called destruction of the cell. What are the examples? Like autoimmune hemolytic anemia, that is hemolysis will occur, cell destruction will occur. Immune thrombocytopenia, platelets are destroyed. Transfusion reaction, that time also hemolysis will be there. Hemolytic disease of the newborn, that is also destruction, type 2 hypersensitivity reaction. Okay, come to the inflammation part. Inflammation में what happens? Binding of this antibody to the cell surface, this antibodies to the cell surface, and then what happens? There will be activation of the complement system. Here cytokines will happen. Now there is activation of the complement system. Complement system will activated. Okay, complement system is activated. So what happens here? These complements are going to destroy or create the inflammation here. For example, good posture syndrome, no, right? This will act on, these complements will sit on this basement membrane of both alveolar basement membrane and renal basement membrane, right? That is a good posture syndrome, very famous. And rheumatic fever, you know that this molecular mimicry will happen between these pyogenes, and then those M protein will come and bind here, and then there will be what complement reaction, that is type 2 hypersensitivity reaction. Then hyperacute transplant rejection, this is very important example. Inflammation में one is good posture, there is rheumatic. The third example is hyperacute transplant rejection. Mean within seconds, like within, as soon as during the procedure of the transplant, that time only there will be a rejection, necrosis will happen. Okay, there will be necrosis of the donor kidney or any transplant rejection, for example kidney, I said. So that is inflammation part. One more is cellular dysfunction. Yeah, cellular dysfunction mein there will be these antibodies will be there, like whatever what I told is type 2 hypersensitivity. Type 2 means B means antibody, antigen antibody reaction. Okay, here the antibody antigen reactions will happen, and then these antibodies will cause cellular dysfunction, not the destruction, not the inflammation, but dysfunction. That is I will say an example, then you will understand. See, myasthenia gravis, right? The antibodies against acetylcholine receptor, that will what will happen? There will be a dysfunction of the actual acetylcholine, that is there will be no contraction of the muscle. That is myasthenia gravis. Graves disease, yeah, Graves disease, thyroid receptor में act करना. Pemphigus vulgaris, desmoglein, you heard of it? Yeah, vulgaris. All these are example of cellular dysfunction. Now you know what are these type 1 hypersensitivity, it is just an anaphylaxis reaction. It can have two types, okay, immediate and late. Late means not too late, it's just in hours, okay, within hours. And immediate may within seconds or minutes, okay. That is immediate and late reactions of anaphylaxis. B is for type 2 antigen antibody. In this DID, destruction, inflammation and dysfunction, all the examples for that. Yeah, this is just anaphylaxis. Eosinophils is just like an allergy, asthma, the allergy for the food, bee sting allergies, or even the test, that skin test, blood test to do allergic specific IgE, we do know the skin test, those are all comes under in anaphylactic reaction. DID is destruction, inflammation, dysfunction. Now we'll go for 3, type 3 hypersensitivity reaction. 3 means what I told you to remember, C, right? A B C D. 3 is C. Okay, C is immune complex, formation of immune complex. Okay, formation of immune complex mechanisms, like complex activate the, like, see, there are complex antigen antibody complex will be formed. Antigen antibody complex will be there. That complex will go, and here this C is complement system is activated. Here the complement system is activated, that is C3, C4, those systems are activated and then cause these symptoms. But here this is complement immune complex, antigen antibody complex. Okay, got it? Don't confuse between that and this complex. In this the examples are like serum sickness. Yeah, time is running. Serum sickness, Arthur's reaction. Okay, the serum sickness is just 1 to 2 weeks later antibodies are produced against these immune complex. Okay, immune complex, usually what happens, serum sickness may, what happens is these immune complex come and deposited in the tissues. Okay, tissues में deposit हो गया, और and this complement activation will happen. Then complement activation, then will be tissue damage. Okay, this will happen, there will be a decrease C3 C4 levels because antigen antibody complex may, here this there will be a decrease C3 C4 levels because it is all used up here. Okay, this C3 C4 levels are used up, so there will be a decrease C3 C4 levels, and it happens in 1 to 2 weeks later. Okay, 1 to 2 weeks after the exposure. That is complex. And another Arthur's reaction is nothing but just a local subacute inflammation, subacute immune complex mediated hypersensitivity. It is like intradermal injection if you have taken, and like if you have pre-sensitized IgG antibodies to that, then individual may, like, we will enhances the reaction, that is antigen antibody complexes will be formed, that will cause the fibrin or necrosis or like edema and this reaction around the skin. That is one thing. And in this example you might have heard the like famous mnemonic SHARP, right? S for SLE, H for what, I don't know. Okay, let's see. A for arthritis, right? Arthritis, rheumatoid arthritis, reactive arthritis, PSGN, IgA vasculitis, and everything is comes here. HSP, yeah, HSP, PAN, PSGN, PAN, polyarthritis nodosa. All these are examples for this type 3. Now we'll go for type 4 reaction. Type 4, what I have told you to remember, D. D say delayed immunity, right? Delayed hypersensitivity reaction. Okay, this is delayed hypersensitivity. What will happen here? Here the direct cytotoxic, direct killing will happen. That means CD8 cells will release, CD8 cells will get activated, and direct killing will happen. This is like also inflammatory reaction. Even the CD4 cells antigen recognition will happen. And example for this is contact dermatitis. Yeah, contact dermatitis. How this contact dermatitis will happen? Whenever you are exposed to some poison, IV, nickel allergy or something like that, it will show a reaction late, right? That is how it happens. Then graft versus host reaction. This will happen after like months. Then you can remember as T's, all T's, T cells, yeah, T cell dependent killing, transplant rejection, late transplant rejection, not hyperacute. This TB test, this all come under here. Touching, that is contact dermatitis. Last one is a delayed one. Okay, that's it about today. Have a nice day.